Hello, so this person is asking what is idiopathic condylar resorption, and is it something that you're born with or is it something that you develop later on in life? So let's talk about this. So idiopathic just means something of an unknown origin. Condylar resorption just refers to bone loss at the condyle. So the condyle is the very top portion of the mandible. So the mandible is just one piece of bone that ends in the condyle, and actually the condyle touches your skull and it kind of becomes a hinge. So when you open and close, if my fist is the condyle, when you open and close it just kind of rotates, and there's a disc called the temporomandibular disc that's on top of the condyle. Okay, so this condyle normally kind of looks like nice and round, almost like a fist, and what happens in some patients, you can get some bone loss at this condyle and the condyle gets shorter. So that's the condylar resorption. It's referring to bone resorption. And what happens, because it's a hinge for your jaw, if this gets shorter, the jaw actually sinks back and up. So these patients often develop an open bite. And it's not just an open bite, but it's actually an open bite where your jaw is regressing back. So you develop more of a overjet, or what's called a class 2 relationship. So you get an open bite and a little bit of a class 2, so it starts looking like that. Sometimes it's more mild, kind of like this, and eventually with time it gets bigger and bigger. Okay, so condylar resorption just refers to resorption at the condyle of an unknown origin. Now, is it something that patients are born with, or is it something that patients develop later on? Okay, so it's not something that you're born with, it's something that you develop later on in life. Most patients are females. There are some males, maybe like 2 to 5%, but most of these patients are females, and it seems to happen during puberty, and then it seems to happen again like during pregnancy and menopause. So most of these patients, when they first develop this condylar resorption and open bite with a class 2, and class 2 just refers to the overjet, that's the space between the upper and lower teeth, so they kind of look like that. Most of these patients usually around age 12 to 16, and again, usually this happens again when the patients are, you know, they get pregnant, they get children. So it seems like a lot of patients have rheumatoid arthritis, or they have some kind of hormonal issues. We don't really know why this happens, but it's just referring to the shortening of the condyle of an unknown origin, and it's definitely not something that you're born with. It's something that you develop later on in life. So it's very important to diagnose this, because there's not a really like a quick fix for this, but the first step is to get this diagnosed and then come up with a treatment plan. But the first step is to recognize that you're having condylar resorption, and it's something definitely that you develop later on in life, but it's not something that you're born with. Okay, and it's definitely related oftentimes to rheumatoid arthritis or different medical conditions. Okay, so hopefully that answers your question. Bye.